My name is Heather Vandiver. I am from section 7606 M50. Today is August 29th, 2021. I'm going to first show you the room. It's my patient. This is my dad, who's going to be holding the camera for me. All right. First, I'm going to explain to my patient we're going to be doing an assessment today. Wash my hands. And I'm going to start with assessing skin first. Every time that I'm assessing the skin, I'm going to make sure to note the skin color, temperature, moisture, texture, any edema, the skin turgor, any scars, lesions, or any buzz. First, going to note the head size, shape, and position. Then going to move to the scalp, noticing the hair distribution, male pattern, baldness, the hair color, and texture, noticing no infestations or tenderness or indurations. I am then going to move to the temporal arteries, making sure there is no tenderness here. I'm then going to go to assessing the lymph nodes for any swelling or tenderness. I'm first going to start with the pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Next, we're going to move on to assessing the cranial nerve 5. For cranial nerve 5, I'm going to assess over the masseter muscle while the patient clenches the jaw, noting that you can feel me touch on both sides equally. Okay, and we're going to assess cranial nerve 7. Cranial nerve 7, I'm going to have you lift your eyebrows, smile, frown, pucker your lips, puff your cheeks, and I'm now going to move on to the eyes. I'm going to first inspect the lashes, the brows, and the palpebral fissures, and then I'm going to assess the sclera and conjunctiva for any drainage, redness, lesions. Next, I'm going to assess for cranial nerve 2. Going to be assessing the peripheral and central vision. Tell me the lowest line you can read.
LTFPH.
Okay.
LTFPH.
Okay. Next, I'm going to move on to assessing cranial nerve 3, which is going to assess the pupillary response to light. And convergence. And next, I'm going to assess cranial nerves 3, 5, and 6, noting that there is conjugate gaze with extraocular movements. Follow my finger. How many fingers am I holding up? Look straight at me. How many fingers am I holding?
5, 4, 3, 2, 2.
Okay. Next, I am going to assess the red reflex. Okay. Now we're going to move on to the Nurs. First, we're going to inspect the skin again, noting the shape and position that is midline of the nose. I'm going to inspect nasal patency. And then I'm going to palpate the frontal and maxillary sinuses for any tenderness. Next, we're going to move on to the ears. Noting the shape and position of the ears, I'm going to palpate the pinnae and the tragus for any tenderness. And then I'm going to assess the auditory canal, noting that the tympanic membrane is gray and pearly in color, no redness or swelling or fluid present. Other ear. Same on the right ear. Next, we're going to assess cranial nerve 8. First, we're going to assess with the whisper test. I want you to repeat after me.
99.
Okay. Then we're going to assess cranial nerve 8 using the Weber test for lateralization. Feel equally on both sides.
Yes.
Okay. Next, we're going to assess the Rhine. This on the back. Tell me when you don't feel anymore.
I don't feel it anymore.
Noting that air conduction
I don't feel
is
it
greater than bone conduction. Right. Next, we're going to move on to the mouth. First, we're going to inspect the lips, the tongue. Open it for me. The buccal mucosa, the teeth, and open up for me. I'm gonna do the posterior pharynx and tonsils. No tonsils present. And then we're going to palpate over the jaw for any TMJ, noting any crepitus, subluxation, or tenderness over this area. Next, we're going to assess cranial nerves 9 and 10, having the patient stick out their tongue and say "ah," noting that the soft palate and uvula rise with phonation. Next, stick your tongue out for me. Assessing cranial nerve 12, making sure the tongue is midline without fasciculations. All right, now we're going to move on to the neck and throat. First, with the neck, inspecting the skin, we're going to palpate the trachea and then palpate the thyroid. After palpating the thyroid, we are going to palpate carotid arteries. Then we would auscultate, listen over the carotid arteries for any bruits. Next, we would test the range of motion of the neck. So I'm going to have you flex your neck, extend, hyperextend, to lateral flexion to your side, other side, and rotation. Perfect. And then we're going to assess cranial nerve 11. I want you to shrug your shoulders against my resistance. And cranial nerve 11 is intact. All right. If you will, turn around for me. Get to your back. I'm next going to go to the back. I am going to use my fingers as the stethoscope. First, I'm going to inspect the skin of the back. I'm going to note that the patient is not in any respiratory distress. I'm going to palpate for bilateral and equal chest expansion and tactile fremitus. Deep breath. Okay. I'm going to percuss each lung field. Next, I'm going to auscultate each lung field starting above the scapula. I'm going to go side to side and down in the intercostal spaces to the posterior lung fields and also the sides. Next, we are going to assess for agophony. So I'm going to put my stethoscope on the patient and have the patient say E.
E, 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 E.
Next, we're going to assess for bronchophony. I'm going to have the patient say 99.
99, 99, 99, 99, 99, 99.
And then we're going to assess the whisper pectorality. So I'm going to have you whisper 99. Okay, perfect. Next, we are going to go to the anterior chest. First off, inspecting the skin, noting symmetry, contours of the chest. We are going to palpate for bilateral and equal chest expansion and tactile fremitus. And out. Okay. And noting that the patient is not in any respiratory distress. And now we are going to auscultate each lung field. After that, I will take my stethoscope and we are going to auscultate over the 5 areas of the heart using the bell and the diaphragm. We're first going to start with the aortic, pulmonic, Erb's point, tricuspid, and mitral. Again, with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm then going to palpate for the point of maximal impulse, and when I find that, I will listen to an apical pulse for a full minute, noting the rate and regularity. Okay, and then I'm going to have you lay back for me with your head this way. I'm going to be inspecting the chest walls, noting no heaves or lifts. I am then going to auscultate for any bruits over those 5 cardiac points again, aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm then going to auscultate over those 5 points again with the bell and diaphragm, aortic, pulmonic, Erb's point, tricuspid, and mitral, and again with the bell. And then I will have the patient sit up if we were in an exam chair to 30 to 45 degrees and notice no jugular vein distension present. Okay, you can stay right there. Next, we're going to move on to the abdomen. First thing I'm going to do is inspect the skin of the abdomen again, noting that there are no the contours and symmetry of the abdomen. I am then going to auscultate with my stethoscope over the aorta, the renal arteries, iliac arteries, and then the femoral. I'm listening for any bruits. Next, I am going to auscultate over the 4 quadrants for bowel sounds. Okay, say normal active bowel sounds. Next, we are going to percuss over each quadrant, looking for any dullness, flatness, or tympany. Okay, and then we're going to palpate for any tenderness or masses. Come over here and we will palpate. Make sure you can see. I'm going to palpate the spleen. Okay, and then palpate the liver. Sorry. And then I will have you sit up at this point, facing me. And then we're going to assess for any CVA tenderness. Any tenderness? No tenderness. Okay, perfect. Next, we will move on to the upper extremities. With the upper extremities, we are going to be assessing the skin and the joints and range of motion of all the joints. We're going to assess the joints for any warmth or tenderness or swelling, and assessing for skin integrity and edema as well. We're going to first start with our hands. We're going to assess capillary refill, which is less than 3 seconds. We're going to assess the radial pulses. Radial pulses are 3+ and equal. We're going to assess for vibratory sensation over the wrists. Okay. And next we're going to assess the range of motion of your fingers. I want you to flex, extend, adduct, and abduct. Okay. We're going to assess hand grip strength. I want you to squeeze my fingers as hard as you can. Hand grips are 5 out of 5. Next, we're going to move to the wrist joint, noting no swelling, tenderness, warmth. I want you to extend, or flex, extend, hyperextend. There you go, move to the side, perfect. Now I want you to we're going to inspect range of motion of your elbow. So I want you to flex, both of them, flex and extend, perfect. And we're going to test the strength of the biceps. I want you to try to pull up against me. Strength is 5 out of 5. Now assessing the triceps, push against me. Strength is 5 out of 5. I'm going to come up here and inspect the shoulder joints. I want you to lift your shoulders up, rotate for me. No tenderness or pain. Perfect. We're going to assess the strength of the shoulder girdle. Hold your arms like this. Try not to let me push him. Shoulder strength is 5 out of 5. After that, I'm then going to assess for graphesthesia. So I'm going to, I want you to tell me what I draw on your hand, okay?
That's a B.
Okay. And then I would assess for stereognosis. I would put a coin or a small object in his hand, have him close his eyes at this point and tell me what that object is. Okay. After that, we're going to assess cerebellar coordination. I want you to put your hands on your lap and flip them back and forth. Perfect. And then we're going to assess, I want you to touch my finger and touch your nose. Okay, perfect. And then we're going to move on to the deep tendon reflexes. And start with your brachiomedialis. Okay. Bicep. Tricep. Angle your feet if you can. Patellar. Achilles. And he would have his shoes off and we would assess the Babinski. I would slide this up his foot and make sure his toes come in. Okay? Next we will move on to the lower extremities. Take your shoes off real quick for me. Assessing the lower extremities, we're going to assess again the skin integrity for edema, swelling, warmth, tenderness in any of the joints. We are going to check the capillary refill of his toes, noting that they are less than 3 seconds. Perfect. I'm going to assess the dorsalis pedis pulses, 2+, the posterior tibial pulse on both sides, and the vibratory sensation once again. Okay. And then we are going to inspect the toes, range of motion of the toes. Yep, you can flex them and extend them. Perfect. I'm going to have him and push against my hands to assess the strength of the ankles. Okay, pull against them. All right, 5 out of 5 strength there. We're going to assess range of motion of the ankles. No pain, tenderness there. We are then going to make sure you can feel me equally on both sides. Perfect. I'm going to assess the range of motion of the knees. I want you to extend and flex. Perfect. And hyperflex, or hyperextend, excuse me. There you go. Perfect. No pain or tenderness there. Okay. Then we're going to inspect the joints of the hips, noting no pain or swelling there. At this point, I'm going to have you stand up. We're going to assess the range of motion of the hip joint. I want you to flex, extend, and then hyperextend. And then if you can laterally rotate. Perfect. And do the same on this side. And hyperextend. Okay, and then rotate. Perfect. All right. After we inspect the hips, we are going to scoot up a little bit. Turn around and inspect range of motion of the spine. So I want you to bend all the way forward. When he bends all the way forward, I will also assess the curvature of the spine, noting no scoliosis is present. Go ahead and stand up straight. You can lean back a little bit. Yep. Arch back a little bit. There you go. And if you lean side to side for me. Perfect. Okay. Good range of motion of the spine. I want you to turn towards me. We're going to assess for Romberg's sign. I want you to close your eyes with your feet together. Right. There is no swaying back and forth. And open your eyes. I want you to walk to the door and back. I'm going to assess the patient's gait, noting that it is regular and tandem. Okay. And come back. And then I want you to hop on one foot. Perfect. And hop on the other foot. Good. All right. And that concludes my assessment.